Hi, today I'm going to talk on a revolutionary technology, DynamX, which is 1927 nanometers non-ablative fractional laser. When you talk about fractional lasers, there are a lot of technologies from erbium yak to carbon dioxide, erbium glasses, but DynamX places itself nicely in between the ablative and non-ablative, making it a versatile tool for doing treatments on skins of color without getting any complications as well as downtime. So let me take you to this particular platform, DynamX. This is a small but a strong punch compared to our carbon dioxide technologies. It has a beautiful display, widescreen display on the platform. When you switch it on, what you see is auto mode or manual mode. Auto mode, if you click auto mode, you have different indications which are already mentioned here: melasma, resurfacing, dark circles, intimate whitening, which is genital lightening, as you know, rejuvenation, and scars. And then there are different Fitzpatrick skin colors are mentioned here from 1 to 6. So let's say melasma, and let's say you choose skin color 5, and then you confirm. So what you see are the default parameters on the platform. So these are the default parameters from where you can start the procedure just by knowing the skin color and so on. Let's say if you choose resurfacing, the parameters are a little different and so on. So every set of indication will have a different parameter, and these are prefixed parameters. You do not really have to do much in terms of how to start and what parameter to keep. So this makes the platform very simple and easy to handle, not only by your trained laser team also. While if you go back and press the manual mode, you will see different configuration. You will now wavelength, which is 1927 nanometers. It is a non-ablative platform. I'm sure you remember from our previous videos, fractional lasers are either ablative or non-ablative. The main ablative laser is erbium yak, 2960 nanometers, which is very strongly absorbed by the chromophore water, and then followed by carbon dioxide. 10,600 nanometers is the wavelength, which is actually 20 times deeper penetrating than erbium yak. While if you go towards the non-ablative side, means the platform which does not burn the skin. Without burning the top layers, they enter the skin layers. And then you have the option which is a thulium laser, 1927 nanometers, and erbium glass, 1550 or 1560 nanometers. Now, this particular platform being on little higher in terms of water absorption, this is more stronger. This is much stronger than erbium glasses, but less ablative than carbon dioxide, making it a versatile tool for treating the skins of color. Because the major problem when you treat skins of color is that you end up having the downtime as well as higher chances of developing post-inflammatory hyperpigmentations. What you can see here is, like any other platform, the wavelength is fixed, 1927 nanometers. Then what we have is the energy. You can increase or decrease the energy. Then you have the pulse width. You can increase or decrease the pulse width. Let me tell you where pulse widths in fractional lasers are different from technologies like diode lasers. Because in diode lasers, when you do hair reduction, if you increase the pulse width, you become gentle because you are delivering energy over a longer period of time. While pulse width in these platforms, in fractional platforms, actually means exposure time. So if your pulse width is longer, this is just the opposite of a diode laser. You are burning longer in this particular platform, so you are more aggressive. Alright, then there is another parameter here, which is overlap. You can press and make the overlap twice. That means when you are firing, the system will complete one fire and automatically it will start to fire second time. So double pass, it will fire in 2 passes. And then there is a pattern formation. The pattern, basically you can change the axis, x-axis and y-axis. So you can have a rectangle, you can have a linear line, you can have a square, and so on. So depending on the treatment area where you are doing, let's say you are doing the upper lip and probably let's say you're doing a cleft surgery scar on the upper lip, so you want to have a rectangle instead of a square, and so on. So you can have a bigger square, you can have a bigger square, you can have a smaller square, you can have a bigger rectangle, you can have a smaller rectangle, you can have a linear line, and so on. Alright, then there are different options in terms of how you fire. You fire in a random manner. So when you select a random, system will fire, the fires will come in a random manner, and the advantage is patient will not feel the pain or the heat at one particular point. While the other option is center, so that means the beams are coming from the center and marching outwards, and the third one is orderly, in which it is marching forward, and so on. Then, as you see in any fractional laser, what you say, the MTZ, the gap between the microthermal treatment zones, that is the interdistance space between the microthermal zones. So you can increase, which is density actually. So you can increase or decrease the density. If you reduce the space between the two fires, you are more dense. If you increase the gap between the two microthermal zones, you are less dense and you are gentle. Alright, and so on. So this is the overall platform and the configurations. So this is the fiber optic soft arm of the DynamX, and this is the fractional tip here, which you place and you press with the foot pedal, a beautiful foot pedal which can be locked with the cover, so that you will not be able to press it by mistake. So you open it and then you press ready and you fire.
सर, आप पहले डॉक्टर हो जिसने मेरी प्रॉब्लम को बहुत अच्छे से समझा है। मैंने बहुत क्लिनिक और हॉस्पिटल के चक्कर काटे थे, बट मतलब जो मेरी प्रॉब्लम है, मेरे हिसाब से मुझे लगा कि वो लोग वो चीज़ समझ ही नहीं पा रहे थे। आप पहले ऐसे डॉक्टर हो जिसने मेरी प्रॉब्लम को बहुत अच्छे से समझा और बहुत अच्छे से ट्रीट किया आपने।
हाँ, बट आई एम वेरी श्योर कि अब चेंजेस भी आपको, यू विल हैव रिमार्केबल चेंजेस। और
हाँ।
अच्छी बात ये है कि जैसे जैसे टाइम बढ़ेगा आपको चेंजेस और बेटर लगेंगे। अभी आप आई वुड से 3 हफ्ते में व्हाट यू आर फीलिंग, इन अनदर 3 months व्हाट यू विल फील विल बी ऑन नेक्स्ट लेवल एक्चुअली। सो दैट विल कीप इंक्रीजिंग। सो दैट इज द ब्यूटी ऑफ दिस पर्टिकुलर ट्रीटमेंट। प्रॉब्लम क्या है, एंटी एजिंग ट्रीटमेंट में
मेरे को तो विजिबल रिजल्ट दिख रहे हैं और मैं बहुत सेटिस्फाइड भी हूँ। मैं कह तो रही हूँ, मैं फिर से कह रही हूँ, आप पहले ऐसे डॉक्टर हो जिसको मुझे अपनी प्रॉब्लम पूरी नहीं बतानी पड़ी। आपने खुद इतने अच्छे से समझ लिया, मुझे बहुत खुशी हुई और बहुत सेटिस्फाइड हूँ।
थैंक यू।
मैं ट्रीटमेंट से बहुत सेटिस्फाइड हूँ और बहुत अच्छे रिजल्ट्स भी मिले हैं।